Thank you very much. I hope you can all hear me okay, and just let me know if I need to speak up a little bit. But basically, I'm the CEO of the Midwifery and Maternity Provider Organisation Australia, and I've been a midwife for 20 years. So most of the questions that I'm answering today are based on people's experiences. They're questions that have been asked of me often over again, so they're not just out of the thin air. I'm also a mother of three, and I think that also provides some sort of background for these questions, because they're things that I thought about myself. I might not have necessarily asked them, but I certainly thought about them when I was pregnant. The biggest challenge is getting the answers to 10 questions into this session, because there's a lot of information. So please feel free at the end to come over to the Meet the Midwife Lounge, which is where we're based, and get some more details of the questions towards the end of the session. So the first question that I get asked is a really normal question. Do I need to get my home pregnancy checked by anybody? Now, the short answer to that question is no. Basically, your home pregnancy tests, they're very accurate. For most women, you'll find that they'll give you an answer as to whether you're pregnant or not straight away on the spot. Your care provider will then let you know that, what other steps that you might need to take. So see question 2, because really you do need to see somebody within the first 10 weeks of pregnancy. And we recommend that for a lot of reasons. There are quite a lot of tests to be done in the early part of pregnancy, and there are things that you need to think about and do and avoid doing in those early stages. And it's really good to get a basic sort of level of information about that before your baby starts to grow too much, because obviously that's the time when baby's actually starting to grow, the cells are multiplying, and things are really happening. Now, if you've got any pre-existing medical conditions and you haven't seen your GP or your specialist before you've fallen pregnant, it's actually really important that you do see them pretty much straight away as soon as you fall pregnant, because things like medication may need to change. There are certainly forms of antidepressant, forms of other sorts of medication that need to be altered once you're pregnant. And so it's really important that if you're on something or you've got some sort of pre-existing condition, that you do see your care provider. But the other thing that's really important in seeing a care provider is actually knowing what's available to you. So there are basically 3 different main people that provide pregnancy care: midwives, GPs, and obstetricians. Both midwives and GPs you can see directly from the street. So you can actually go in, refer yourself, you don't need a referral from anybody else. If you decide that you want to see an obstetrician, you will need a referral from your GP or from your midwife to an obstetrician for care. And basically once you've decided what you want to do, you can seek out that referral. So the different sorts of models of care, and we talk about models now, they are public care in a public hospital, and you have various people providing that care. So it'll be midwives, different doctors, registrars, different people involved in that care. GP hospital with various care providers. So if you see your GP, you can still see them for most of your pregnancy care, but once you hit the hospital system, you will see a range of different people. So in your visits in the hospital, you'll see different people, and also for your labour and birth, you'll see different people, and postnatally, you'll see different people. The 3 different options that are at the end here all mean that you have the same person providing you with care throughout. So public hospital care with a continuity of care midwife, and that you actually specifically have to ask at your hospital if you want that sort of care. So it means that you're seeing the same midwife for your visits when you're pregnant. They are on call for you for your labour and birth care, and they see you to 6 weeks after your baby is born. So if your hospital has that model of care, you can ask for that, and that means that the person that's looking after you in your birth will be somebody that you know. So the last 2 forms of care, private obstetric care, means that you see a private obstetrician, and obviously that's sort of one of the very normal forms of care in Australia, where you go to your GP, you're referred to an obstetrician, you see them through your pregnancy, they're there for your birth, and they usually see you each day for the first few days after your birth. Just important to remember that they're not actually going to be the midwife providing your care in labour, and that means you will have somebody there with you the majority of the time that you don't know, but for most women that's what they choose to do. The last option is the one that I am involved in, and that is private midwifery, continuity of care, and that is where the same midwife provides your care through your pregnancy. They're on call for you for labour and birth, and they see you for 6 weeks after your baby's born. And that option is now available in basically all major public hospitals in Brisbane and in the southeast corner. So it is something that is available to women in this area. So think is what I'm saying. Think about your birth choices. Think about that. We're going to go through some things here, and certainly if you need more information about birth choices, and make sure that what you want fits with what you're choosing. So, are there things I shouldn't do in my pregnancy? The short answer is definitely yes. You know, you will have heard about things like smoking, alcohol, drugs, but obviously there are a range of prescription drugs and even over-the-counter drugs that are not awesome in pregnancy. And you need to talk with your care provider, get online, find out what sort of things you shouldn't have. So if you're regularly taking things like Nurofen, you should be talking to people about that. Aspirin, talking to people about that. Even some of the antihistamine drugs, talking to a care provider about those, because they are not necessarily safe during pregnancy. Basic Panadol is a fairly safe drug and can be taken throughout, and usually without any complications. So radiation is obviously another one that most people know about. You shouldn't obviously have x-rays and things like that. Heat is another one. So going into saunas, having really hot baths, exercising to the point where you're overheating, they're all things that should be avoided in the first trimester, definitely, and probably ongoing in your pregnancy to a certain extent. Work-related exposure, if you're exposed to chemicals and lots of dust and things like that, they can be problematic during your pregnancy. So again, talking with your care provider about what's okay, what levels of those things are okay. In terms of food, the New South Wales Food Authority has the best online resource of any source that I've found around the foods that are good and the foods that are not so good. And they actually list, they're not just focusing on bad foods, they're also focusing on the levels of sorts of things that you should be having in your pregnancy. And they really do provide a very comprehensive online tool that I recommend, even though it is in New South Wales and I'm from Queensland. But it is the best resource. Whoops. So, how much weight will I put on? Now, this is a funny question because it's not how much weight should I put on, it's how much will I put on. And in fact, that really depends on you. It depends on what you put in your mouth, and what you do is really what will provide, will show you how much weight you're going to put on. Your pre-pregnancy weight is a really important factor in how much you need to put on. For women that are on the upper edge of a BMI, and your BMI is your body mass index, so it's about how tall you are and how much actual weight you have on your body. That little graph there is the Australian government's recommended weight gain for women of different BMIs. So women that are in the normal sort of BMI range will put on somewhere between 6.8 to 11 kilos. Now, if we're going on the lower end, we'll obviously want you to put on a little bit more weight, and that's so that you've got the fat reserves there that you will use when you're breastfeeding your baby. And we actually base this on, that women will actually breastfeed their babies, and that actually will use quite a lot of resources in the first few months of life, and that actually does help your body regain its pre-pregnancy weight, and that is absolutely not a myth, it is actually a fact. Those on the upper end, certainly you just need to put on a little bit less weight. You just need to watch what you're eating. And the main reasons for that are around other risks that can develop during pregnancy, like gestational diabetes. So just being mindful. But I do say to women, don't freak out. Don't go over the top with anything in pregnancy. If you've started pregnancy at a higher level of weight, don't freak out and get yourself into a real state about it. It's not the time to lose weight. It's just time to be sensible about what you're eating and what you're doing. Question 5, should I attend antenatal classes? If it is your first baby, you absolutely should go and get some information. I think it's really, really important that in your first baby you do a range of different information. Your second baby is something special for you. So things like hypnobirthing, calm birthing, yoga, things that connect you with your baby and help you to get, a little bit more attention to your mother-baby time is really, really nice. Quality of classes varies really considerably. So if you're going through a public hospital and you choose public hospital classes, you're going to get a big class with lots of people and not very much opportunity to ask a lot of questions. Even in private hospitals, the classes are getting bigger and bigger. So one of the things that I suggest is that you consider investing in some classes, and think about independent classes that are independent of where you're having your baby, so that you can get a range of information choices. I've got one card left here at the moment that is a free antenatal class that is available over the next 4 weeks from Expo. If anyone wants to take a photo of the back of the class for the online resource, it's based in the centre of Brisbane, so it's just worth, at the end of the class if you want to have a look. But I do think that considering it is free, but considering investing in independent classes is a good option. So these 3 women here are all using calm birthing techniques. So I'm not not advertising calm birthing, but I'm just saying that it is something that can be quite useful. The woman in the top left-hand corner is 3 minutes away from having her first baby in that photo, and you can see how peaceful and relaxed she is. So it's not actually a myth; it is actually real that those sorts of techniques do work for a lot of women, not just Princess Kate. So, do I need a birth plan? The short answer to that question is it depends. If you are seeing one of those last 3 options where your care provider is continuous through pregnancy, labour and birth and post-birth, they're going to know what you want. Hopefully they've spent enough time with you in your pregnancy to have sat and had good conversations with them about what you want. If your care provider is seeing you for less than 40 minutes for your antenatal visits, then they're not doing the recommended schedule for antenatal care. Antenatal care by Medicare, recommended visit length is 40 minutes. So if you're getting shortchanged, you need to make sure that you dig your heels in and ask your questions and actually spend some time getting the information that you need. Now, if you are actually getting that and you know your care provider knows exactly what you want, you may not need to actually sit and write it down. However, if you're actually having a baby in a facility where you are not going to know the care providers, or there's potential for a change in care providers, even if there's a potential that your obstetrician has weekends off and works with somebody else, it's really important that you write down what it is that you're wanting, because it's important that they know. There'll be things that you might be really set on, and there might be things that you don't really care about, but it's important that the things that they really, really know, you've got written down. Don't know what I'm doing. Do most women give birth before or on their due date? The short answer is no. About 4% of women actually give birth on their due date. And statistically, if it's your first baby, you are statistically most likely to be at least 5 days past your due date. So don't be in a rush. Be aware that that's very, very normal. You'll often find that care providers try and manage the time that you're going to have your baby. It's not necessary. There's no risk, no additional risk to baby until you get past the 42-week mark. So once you hit 42 weeks, yes, there are additional risks to your baby. But between 41 and 42 weeks, that's the time where most women will have their baby if it's their first baby. And certainly that's the time where, if you're needing to be induced because your baby's not coming or whatever, that's the time where you'd start thinking about that. Any earlier than that is absolutely, absolutely not necessary. If you want more information around those sorts of questions, please come and see us over in the Meet the Midwife Lounge. So one of the questions that gets asked to me is, how long will it last and will it hurt? And the reason that I've got these photos here is to show you that most of the time, birth is not an ER type moment. It is not people screaming down corridors and lying, writhing and screaming in pain. There are times where it is really, really hard, and I'll talk about that in a minute, but even having 2 babies, it can be a very straightforward, normal, happy, joyous process. And the thing that makes a difference often is who's with you and what they actually know about you. All of these women have all had normal labours, normal birth, and none of them are in a really bad way. So no quick answer to how long it's going to last. Statistically, for your first baby, 8 to 12 hours of proper labour, which means regular contractions about 3 minutes apart, but it varies considerably. Labour is hard work. It is called labour. So labour is labour, hard work. it is like a marathon. If you don't prepare and you don't have a team around you of people that you trust and that you actually think are, doing the right thing, then it's potentially you're not going to have the outcome you want. So it's about preparation, and there is, I've been a midwife for 20 years, and it is about preparation. Sure, things can go wrong, but if you have the right people with you in the team, they will manage the problems that go along the way. Question 9, how can I avoid tearing? Oh, I've got a few minutes, so I'm not going to go into it. We know statistically that certain types of care reduce tearing, and we think that that's because there are less interventions involved. So we recognise that midwifery continuity of care, for whatever reason, does have less tearing in the statistically significant amount of reduced tearing. So we know that that's generally because you have less interventions if you're having that model of care, and that I think is the basis for it. The other thing that's really, can really make a difference is education, knowing about your body, knowing what to do to prepare, and actually getting in and doing that preparation for birth. So that's a really cute one. I love that one. So the last question is, what is the best piece of advice you can give me? And I really touch back to the same things that I said at the beginning. Talk to people, make sure that you trust what you're doing. Trust in your people that are with you, your partner. Make sure you trust what your partner knows. Your birth partners need to know, what you want, how it's going, make you feel really confident. If your place of birth, the midwives with you, the obstetrician, if they all make you feel confident, then you'll be great. You'll feel really confident. You'll feel like you're doing the right things. Consider and compare your options. So go and talk to different hospitals, different practices, different people, and make sure that you do the same sort of research that you do, for buying a car, for doing things like that. You don't just pick the first car. You go and have a look, you see, you drive things, you test drive them. So do the same thing, test drive care providers, go and talk to different people. Make sure you're happy with the choice that you're making. It is never too late, even until you've had your baby, to change care providers if your gut instinct is telling you that there's, it's not going well, it's not going the way that you want it to go. That's a little water birth shot, obviously. So some independent sources of information. Queensland Centre for Mothers and Babies has a massive decision-making tools that you can use to get more information that's completely independent, nothing to do with midwifery, nothing to do with obstetrics, but independent advice. Maternity Coalition are the peak consumer organisation for pregnant women and birthing mums, and their website's also on there. So that's my daughter who thinks she's going to be a midwife, and we're transforming maternity services, one birth, one baby, one woman at a time. And so we want to make sure that every person has the access to a known midwife for their birth if that's what they want. Thank you very much. I don't know whether we've got any time for questions. Thank you.